Hi everyone. I am sitting on my terrace in lovely Budapest today because I've got some news and I wanted to share it with you face to face. Today was my 9th immunotherapy infusion, and before each treatment I meet with my oncologist, and he confirmed today that there is no evidence of disease. So there's no visible sign of the two cancers in my body. And the blood work mostly agrees with that. I'll come back to that in a second. But in cancer lingo, what that means, no evidence of disease, is that NED is the status, no evidence of disease. In doctor lingo, they refer to that as a complete response to the immunotherapy. And immunotherapy has done what it's supposed to do with my immune system. And so that's what we had hoped for. And it's done it and then some. I want to be straight with you, as I always am, and a sort of gentle reminder that that does not mean my cancer is cured, and that's not really something that we can chase as a stage 4 cancer. So the term that we are chasing is we've had complete response, now we want durable response. And what that means is, first of all, year 1, which I've just completed, is a very big milestone. Year 2 is what we're going for now. And ultimately, a durable response is assigned, diagnosed at the 5-year mark. So we've got a ways to go before we can get excited about that. So today isn't a finish line, but it is a massive, massive milestone. I'm going to try to breathe through this video. A year ago, I was given 6 months to 12 months max to live by my first oncologist, and making it to the end of that year, still here, no evidence of cancer in the body. Nobody really thought that I would be here to be able to say that on my terrace in the lovely golden hour of the sunlight. For those of you who follow some of the nerdy medical stuff, there's a blood marker called CEA. It's one of the primary tumor markers in my case and in many cancer cases. For me, that's sitting at 14.5. It's supposed to be under 5 because I'm not a smoker. And so that's something that we still have to keep an eye on. Getting it under 5 is still a goal, but the important thing, and why the doctor went ahead and determined no evidence of disease or no evidence of cancer, is that that marker has been stable since May. So it can indicate a presence of a tumor, and if that tumor were growing, the marker should be going up. It's been stable. So because this marker can also indicate some types of inflammation and other causes associated with this marker, it's a little bit of a wait and see. It's not a worrying level. Before I had surgeries and before I started treatments, my marker was 140, and it can go into the thousands. So, or, over 1,000. So to be at 14 is something to watch in the lab, but it's still, compared to what it could be and where I was, it's still very, very good. So, as I said, I think I will stay, and you'll see I'm reading some notes so I don't ramble, but because I've had a treatment today, my brain is also not functioning very well. But at least for another year, possibly a year and a few extra months, I need another 15 treatments to complete the entire regimen. I get one every 4 weeks. And once we hit the 2-year mark, that is the soonest that my team would consider whether it's safe to stop the treatments. So that is a major milestone in my particular types of cancer with my particular genetic makeup, that after 24 treatments or 2 years, that the immune system can be so reprogrammed that it begins to preserve itself or preserve that repaired state longer term. So not necessarily, nobody's going to use the word permanently, or like I said, nobody's going to use the word cured, but it can trigger a durable response, a long-term response. And I would still continue with monthly checkups and blood work and CT scans, and that kind of stuff will happen for the rest of my life. But it is possible at year 2 to stop the immunotherapy, and we'll discuss it when we get there, ultimately. To all of you, I want you to understand something, and that is that I'm not sitting here by myself. I mean, look around, I kind of am. But you know what I mean. Every surgery that I've walked into, every scan that I've walked into, every treatment that I've walked into, I've walked in carrying you with me. And for those of you that are involved with the GoFundMe campaign, you're helping in an additional way to help me bridge sort of the fallout of all this cancer and get back to the things that are the things that I do, like building Jacob. And I am in absolute speechless way grateful. It's far too small to say that. But even in English, I can't think of better words. So, I mean it with everything that I've got. Thank you. I'll keep you posted every step of the way, of course, like I always do. There will be more good scans. There will be more good blood tests. There may be not so good in the future, and I will still have hard days. The fallout of the cancer in my body and in the world around me is a severe impact. So I'll continue to struggle and continue to fight with that. And every 4 weeks I'll have a day like today where I sleep until the golden hours, because it does take a toll. It takes a day out of my month. Essentially, it used to take a week. And so I'm thankful that, I just lose a day at this point, maybe a couple of days. But today, this day, and at our upcoming garden party, we celebrate a year, celebrate no evidence of cancer. We celebrate the complete response, and we celebrate all the friendships that are attached to it. So, onward to year 2, and I'll see you in it. Bye.